silent sinus syndrome or atelectatic sinus, or you can say collapse sinus syndrome, is a disease characterized by the inophthalmos or hypoglobus secondary to the collapse of the orbital floor in the presence of asymptomatic chronic hypoplastic maxillary sinusitis. So, this is the definition of collapse sinus syndrome, atelectatic sinus syndrome, or silent sinus syndrome. These patients mostly present with asymmetrical small eye on the affected side, and there are no symptom of nasal pathology. Clinically, there is progressive anophthalmos, unilateral ptosis, diplopia, and eye symmetry is the classical finding in silent sinus syndrome. And this is spontaneous asymptomatic collapse of an airway sinus associated with the negative sinus pressure. On CT scan, there is unilateral sinus opacification, thinning of the orbital floor, and there is lateralization and atelectatic uncinate process is there, and uncinate process is very small and it is atelectic, and there is retraction of medial and posterior lateral wall of the maxillary sinus like this picture. So this is the classical finding in CT scan. An atelectic uncinate process often occurs with the hypoplastic or non-ventilated maxillary sinus, or maybe collapsed against the medial wall of the orbit. This combination of factors may lead to negative pressure gas metabolism within the maxillary sinus and inward collapse of the surrounding walls, including the floor of the orbit. That's why this is asymptomatic collapse. That's why it's called silent sinus syndrome. A posterior to anterior and retrograde uncinectomy is indicated to prevent orbital injury in these type of the cases. Medial displacement of the uncinate may also occur as a result of polyposis and mass lesion, filling the middle meatus and maxillary sinus. Lateral displacement of uncinate may also occur with the large concha bullosa, polyposis, or other mass lesions. Pneumatization of uncinate process may also occur. So that may be a variant of the uncinate process which may coexist with silent sinus syndrome. Treatment mainly focusing the middle meatal enterostomy with endoscopic sinus surgery, sometime required reconstruction of the orbital floor. So functional endoscopic sinus surgery is the therapy of choice in these type of the cases.